So my name is Peter Hotez. I'm Professor of Pediatrics and Dean of the National School of Tropical Medicine at Baylor College of Medicine. I have an MD and PhD from the Tri-Institutional Program at Rockefeller University and Weill Cornell Medical College. Following that, I was a pediatric resident at the Children's Service of the Massachusetts General Hospital, then did a pediatric infectious disease fellowship at Yale, and then actually stayed on the faculty at Yale for a decade before I became professor and chair of microbiology at George Washington University, before moving to my current position as dean at Baylor College of Medicine in 2011. I've been a member of the Pediatric Infectious Disease Society for almost 30 years, in fact when it first started. And it's been a very important society for me, and the reason is this. There are actually not a lot of us. There are not a lot of pediatric infectious disease specialists. And as a result, it's not easy to stay connected. And the Pediatric Infectious Disease Society, PIDS, is the major convener to keep us kind of all together, because we share a lot of common problems and issues around not only technical problems like antimicrobial resistance or around vaccines, but also around advocacy, because now, as we all know, this has become an important social and media issue where we're missing out on a generation of kids not receiving their usual childhood vaccinations, a whole generation of teenagers missing their HPV vaccines, so we're condemning a whole generation of men and women to cervical cancer, throat cancers, and other cancers. And we know so many kids are not getting their influenza vaccine. So belonging to Pediatric Infectious Disease Society, PIDS, is not only a way to share common practices, but to unite together to take on these very important social issues that are now emerging in the United States.